Welcome to the Beyond the Surface video podcast, recorded live at the website and video design studio, featuring Beautiful You Medical Spa.
Hey, I'm Jennifer. I'm back with Megan. We're doing our podcast, and Megan's one of the estheticians, and I wanted to bring her on, or we wanted to bring on, or come on together and talk about just questions that people might have. Mine would be for her, as far as coming in for, let's pretend I was a new patient, and what I would expect as a new patient coming in to see you for the first time.
Yeah, so obviously going to get a feel for your expectations, what your plan.
Anti-aging, I want to keep it going.
Yeah, so, maybe something that you're unhappy with your skin, specific areas that you would like to target. And, I'll take a look at your skin, get a feel for it, see how it reacts, look at your skin type, what would be appropriate.
And that's something that I'm always, if you know me, which some of my patients know, I talk to my patients about this all the time. I have highly reactive skin. I'm very sensitive. I also am very allergy prone. So, and I know, and if I don't want anybody that is like me, who has a lot of allergies and has specific problems with their skin, to be turned off from facials, because I know for me, I have to bring in some of my own products, like my cleansers and stuff like that. And you're able to work with that, correct?
Yeah, absolutely. Yeah, I want to make sure that you're comfortable. And that's the beauty of facials in general. And there are so many different products out there. What we offer, what I use in my, treatment room is going to be medical grade.
Right.
It's going to be for sensitive skin. It's going to be free of all those extra harsh chemicals that would, it's going to lessen the possibility of a bad reaction that I can't anticipate, because I am using medical grade skincare on you.
But on the flip side, as far as reactive, some people are just reactive. And so anytime I come out of a facial, even the most gentle facial, because you can touch me and I turn red, but turning red is fine, correct?
Yes.
Yeah.
Some people are reactive. So that is something that I see all the time. And that's how I am. You touch me, it's going to turn red. And that's not necessarily a bad thing.
I found I found that it's actually pretty good.
Yeah. I mean, you've got great circulation, which is what we want. Some people just get it with heat, redness. So that's where I can look at your skin and decipher, is it just from the heat? Is it just from touch? I'm going to check in with you. I always tell my clients, I'm sorry if I'm being annoying. I apologize a lot, but I'm going to check in with you and make sure that you're comfortable, make sure it's feeling good, because I don't want you to come in and be uncomfortable or have pain or, cause something that's going to make you have a unknown reaction down the road.
And so that's my other question, as far as, so we've kind of gotten into the turning red as normal. What would be something that you would want a patient to call back to talk to you? Like, as far as like side effects or whatever.
Yeah, and if we're going to be doing something a little more invasive, which ideally, we are medical, we're going to get there. That's what we want to do, so we can address different issues. I usually say, if we're going to be doing something like that along those lines, I'm probably going to call you in a couple of days and check in.
Oh, I see. Okay.
I know you do it and I do it too. We always send you home with something, a little sample, just to help with the comfort at home, to lessen any possible side effects. But if somebody were to call me having an adverse reaction, it would probably be something along the lines of like a rash, bumpies, itchy. That's not what I'm trying to achieve. A little bit of pinkness, redness, that's good. Some people do want to see shedding and peeling. It's satisfying.
Yeah.
That's good, because we're getting that cell turnover rate going. We want that to happen, but there are things that we don't want to happen.
Gotcha.
So, yeah.
Okay. And so anytime anybody has a question, again,
always
call.
Always call. And we're all, even our front desk who doesn't do any kind of services, they're going to be able to point you in the right direction.
And I'll tell you, and speaking of our front desk, shout out to Janine. Many of you already know her, and yes, she is a font of information, and if she can't answer it, she will absolutely pass those questions along to the injectors or the estheticians. But Janine is pretty knowledgeable. She's been with us for a while, and if she hasn't done it, then it doesn't exist.
I think that's how a lot of people who work at Beautiful You are. I think we've all, tried.
We try everything.
If we're gonna
suggest it,
you,
yes.
we're gonna do it on ourselves first.
Right.
And make sure to get a feel for it. Make sure it works.
Yeah. And the other thing with that is we have a variety of skin types. So we know, between all of us, we kind of know any of the possible reactions anybody can have.
We're all over the spectrum.
Yeah. But that's it for today. If you have any questions, let us know.
Yeah. Thank you.
Bye.